like to talk to you for a few minutes about cataracts. The word cataract may sound strange to many people, but it's important to realize that cataract is not a disease as such. When we're talking about a cataract, we're talking about the lens of the eye. In order to understand what the lens does, we should think of the eye as a camera. In a camera, we have lenses also, and those lenses will focus the light on the back of the camera on the film. If you look up here at this picture of an eye, the lens of the eye, similar to the lens of the camera, does the focusing for the eye. Light comes in from the front of the eye, goes through the clear cornea, through the clear lens, and it's focused on the back of the eye, an area called the macula, from which the light impulses go into the nerve and back into the brain so that we may see. This lens has to be perfectly clear. When this lens gets cloudy, we call this a cataract. Now it's important to realize that 9 out of 10 people who have cataracts don't need surgery. Nothing has to be done. So the fact that a cataract is present does not mean that an operation is inevitable. This cloudiness of the lens is caused by some changes in the composition of the lens as aging occurs, although it's important to realize also that some cataracts occur in children when they're born. Also, we can have cataracts after injuries, we can have cataracts after the use of certain medications, but most cataracts occur as people grow older. There is a hereditary basis to some cataracts. You may find some families where many people in the family will have cataracts at the age of 20, 30, 40. But most cataracts do occur after the age of 50 to 60. What patients notice when the cataract develops is that it causes some blurring of vision. When the light goes through the lens, instead of being clear, the picture that you see will be cloudy. Now you may see everything, but it's just not as sharp. Sometimes there'll be a little yellow glow to things. Sometimes there'll be increased glare at night. Sometimes during the day, when the sun is very bright, all of a sudden things will seem to blur out. So the effect of the cataract on your vision will depend upon the type of the cataract it is, how dense it is, and where the cloudiness is located in the lens. Now, at the present time, there are no medications known that will prevent cataracts or retard their growth. On the other hand, there are medications that can cause cataracts, and it is important that we try to avoid those when necessary, whenever possible. But on the other hand, if medications are necessary and have a chance of causing cataracts or other complications, your physician will tell you about that. How do we know when someone has a cataract? Well, some patients will come in and say things are fuzzy. Other patients may not realize it. When we examine your eyes, we have you look at an eye chart and have you read certain numbers. Then we will put lenses in front of your eyes to see if we can improve the vision. Because especially early in the development of cataracts, we can often improve the vision with glasses to whereby vision may come very close to 20/20. Some people talk about second sight, which means that as a cataract develops, they become somewhat nearsighted and no longer need glasses for reading. But as long as we can correct you with glasses, then we usually follow the cataracts. We look in the eyes with lights. We look with a special microscope to evaluate the lens, because once again, as we talk about the lens, this is inside the eye, and we need special illumination or microscope to look at this lens, and we determine where the cataract is, how dense it is. Then we usually put drops in the eye to make the pupil larger, because we want to look at the back of the eye to find out if it's the cataract that is causing the blurred vision, or if there may be other conditions such as hardening of the arteries, diabetes, bleeding, or high blood pressure that might be the cause of the blurred vision. Obviously, if we remove a cataract and that is not the cause of the blurred vision, we will not be doing any good. So we like to evaluate the eye completely to give you some idea of what the chances are of improving your blurred vision. And if it's solely due to the cataract, we can be very reassuring, because in that situation, cataracts are about 95%, cataract surgery is about 95% successful. The only way of improving vision with the cataract, the only ways of improving vision are to use glasses when the cataracts are early and then we don't have to do surgery. But as I mentioned, there are no medications that can reverse or dissolve the cataracts at this point. When the cataract gets to the point where it is interfering with someone's vision, or in some situations where it may be about to cause complications such as glaucoma by becoming overripe, we have to think about surgery. There are various methods of performing surgery, which is decided upon by the ophthalmologist. When a cataract is removed, since the lens has been focusing the light on the back of the eyes, we then have to replace this lens with an artificial lens of one type. The classical method in the past has been to use very thick glasses. The difficulty with the glasses in some people is that there is a significant amount of distortion of side vision, and some people have difficulty walking with these glasses. In addition, if you only have a cataract on one eye, we remove that cataract and replace the lens with a pair of glasses, we then get to the point where, because of the thick glasses, the picture that you see in the eye with a thick glass is 20 to 30% larger than what you see in the other eye, which may not have a cataract. And the brain has difficulty putting these two pictures together, so that we then have some problems in this situation. When we replace the lens after removing a cataract with a contact lens, this makes it much easier to use the two eyes together, because the difference in image size between the two eyes then would be only 2 to 3%. However, contact lenses are difficult for some people to use, because if you have arthritis, it may be difficult to use your fingers, and some people don't like the idea of a contact lens. However, they work extremely well and have one great advantage in the fact that many people can wear a bifocal contact lens, and after cataract operation will not need any glasses at all. In addition, for those individuals that may not be able to use their fingers quite as adroitly, we have extended wear lenses whereby a soft contact lens can be left on the eye for weeks to months to years at a time without changing it. With the soft contact lenses, it is usually necessary to wear a bifocal glass or other correction over the lenses. The closest that we can come to approximating the normal vision with the normal image size is with what we call an artificial lens or intraocular lens implant. In that situation, we actually will get to the point where we remove this lens from the eye, and then we replace it with a piece of plastic lens, or in some places, in some situations, a glass lens, which is actually inserted in the eye and placed in the location of the natural lens. And this will provide the closest to the natural vision that we can do. These lenses have been used, the intraocular lens implants have been used since about 1943, when they were developed by Dr. Ridley in England. When we put an implant in, we expect it to last for a lifetime. Although there might be a slight additional risk, this is the way in which most cataract patients are desiring to have their vision restored. And it has been one of the amazing advances in the field of ophthalmology. As I mentioned, surgery is done in the hospital. It is done to remove a cataract. Surgery in most cases is done on an ambulatory basis At this time, we are doing our surgery on an outpatient basis at the hospital, except in the situations where a physician who is caring for a patient prefers to have the patient stay in the hospital for 1 or 2 days. What is done is the hospital reservations are made for a particular day. Several days beforehand, the patient visits their family physician for a physical and evaluation to see if there are any special tests or medications which the primary care physician would like the patient to take while they're in the hospital. And then the day beforehand, the patient goes to the hospital for an electrocardiogram, a chest x-ray, and some blood tests. When the day of the surgery arrives, the patient arrives at the hospital early in the morning, usually without anything to eat or a clear liquid type breakfast, and checks in at the admitting office, following which they are sent up to the ambulatory care floor. When the time comes for surgery, drops are placed in the eye to make the pupil large, following which the patient is taken to the operating room after having been given a small amount of medication to relax the individual. Surgery is carried out usually with what we call local anesthesia, which is an injection to numb the eyes so that it doesn't hurt. It takes about an hour to an hour and a half in the operating room. Following this, the patient returns to their room in their bed with a bandage over one eye. At this time, they can eat and they can be up and around. They usually stay in the hospital for a short time, following which they can go home and resume semi-normal activities. In other words, we don't want them to do any heavy lifting, but they can take care of themselves with their usual routine, cook for themselves, and take care of their house. On the next day, the patient is usually seen in the office, whereby the first evaluation is carried out in reference to the operation. Sometimes the vision is 20/20 on this day, and sometimes it takes longer for surgery for the vision to return. But this is evaluated each time that the patient comes to the office. When the patient goes home from the hospital, and for about the next 2 to 4 weeks, we like the patient to wear a piece of metal as a shield, which is fixed with just some Scotch tape, and the bandage isn't necessary at night while they're sleeping. During the day, it's not necessary to wear any bandage, and if an individual has their regular glasses, they can be worn in the usual fashion. The activities to which someone can return are basically the normal activities except for extremely heavy lifting. Many individuals return to work and driving within 1 to 3 days after the operation. Because of the ability to have patients get up out of bed more quickly, because of the advances in the operating room, the operating microscope, very fine sutures that are used for closing the eye and keeping the implant in good position, it is possible for patients to be up and around much more quickly than in years gone by. We usually have you use some eye drops 3 or 4 times a day, and don't expect you to have any significant amount of discomfort or redness. If there are any unusual problems, such as very red eyes and a significant amount of pain or a change to the vision, we expect you to call the office immediately, since the office number answers 24 hours a day, so that we can answer any questions that might arise. In general, we like to wait 4 to 6 to 8 weeks before prescribing your final glasses. As I mentioned, cataract surgery is about 90 to 95% successful, which is among the most successful type of surgery that can be performed. Restoration of vision is often extremely good and enables individuals to return to their useful activities and to continue working and enjoy life.
Bye.